Paul, you've obviously seen the best of times in generic pharma and some of the lowest times. Do you feel like generic pharma has finally hit a bottom?
Well, Banks, it's just such a great question, and I look at it, in terms of, it depends what side of the industry you're on. So, we talk a lot about the consortiums on the solid oral dosage or retail side. We probably need to start to talk a little bit about the injectable side and the GPO side, but maybe just to start with the consortium. I hope and I do believe that we've turned the corner. Looking at some of the data that gets published out there, it looks like we've seen a flattening, or really maybe a small single digit growth over the last 12 months. And I know COVID impacts some of that, but when you go back in time, when the generics really had their challenges, and it really, to me, it stemmed from maybe three things that occurred, and could those three things occur again? And I think it hopefully will be unlikely. So we knew that when Walmart was looking to join one of the consortiums back in late 2016, that there was going to be visibility back into portfolios. And I think that was really the crux, right? And we were coming out of consortiums with Red Oak and WBAD, throughout 2012 and 13, but there was still that one consortium that was there. And I think when Walmart joined ClarusONE, I think that was something that that provided a lot of visibility to portfolios and pricing. And keep in mind, these three consortiums represent about 90%. I think the other thing, there was two other items back then. I think inefficiencies. I think the consortiums did expose some inefficiencies, Banks, and in generic manufacturing. I think at that point in time, back in the 2013, 14, the view was bigger was better, right? So generic companies were trying to pursue just about every product that was coming off patent. And I think that increased competition. And then the last thing that people forget about, and I think this also had a big impact on how some of the generics really got caught up into inefficiencies and hitting rock bottom, was back in 2013, the FDA changed some of the regulations, and people forget about this. But prior to, I think it was June of 2019, you didn't have to submit an ANDA with 3 full batches of product. And that's an incredible expense, right, for a generic company. And you didn't have the GDUFA fees back then. So I think what we saw pre-June 2013, generic companies were filing a lot of massive submissions into the FDA. Those applications were coming to the market in 2015, 2016, and those were older molecules. And I think there was a large number of applications that created compression, a lot of competition, and I think it exposed inefficiencies. And I say maybe one of the examples, my former company, PAR, we submitted a record 30 applications in 2013. 29 of those applications were submitted prior to June, and then 1 afterwards. And I think what you were seeing were a lot of applications that probably were never going to have value, probably were never going to get launched, probably were never going to get validated. I think that also created some of the issues on the retail side. So I don't think those 3 things are likely to happen again. And the consortium's getting bigger. I don't know. That could be perhaps an FTC concern. On the GPO side, we like the way the GPO models typically run. When you look at the 3 big GPOs, HPG and Premier and Vizient, they represent probably in excess of 90% as well. The Premier models, the HPG models, those are basically member run. It's a different model. we should keep our eye a little bit on the Vizient model is a little bit more like a consortium model, right? And when you get into mature injectables, you could see some further compression on those types of products. But at the end of the day, I feel confident on the consortium side, and I think we just need to keep our eye a little bit on the GPOs because a lot of competition is going in that area.